Salona we yo, papa, salona we yo, mama, salona we all yo, for now when so they go. Salona we yo, papa, make we not well out. Salona we yo, mama, make we not well out. Don't sign no day na this one. Wait teeth and tongue no they jam. If we take them, kill them, and use them, we go see them God. Salona we yo, uncle, not a one my yo. Salona we yo, auntie, now we all get out. They been there before we born. They go there after we don't go. Make we try for make and better for them one way go get focused. Salona we yo, young boy, make we not well out. Salona we yo, young girl, make we not well out. One hand bangles not they shake, one finger not they pick lost. If we all ain't get together, they go better for me and you. Salona we yo, brother, make we not well out. Salona we yo, sister, make we not well out. Grandpa then left and give we, for make we self pass Amon. Refugee not to find title, elect you catch na 5-star hotel. Salona we yo, diaspora man and woman. Salona we yo, local man and woman. When we talk before we think, we must kill before we born. Make we left for take we must, then turn we country to be graveyard. Salona we yo, bamboo, make we not well out. Salona we yo, bamboo, make we not well out. All other side then they be waiting, do we just there for 12? When we make we compete look, but that not look for make we look good. Salona we yo, na papa God himself give way. Salona we yo, he not give we for make we well. When strangers say they can help, now then self then come for help. Make we left for make them take we back, fry we for feed we back. Salona we yo, na papa God himself give way. Salona we yo, he no give we for make we well. When strangers say they can help, now they self they come for help. Then go take them make we feel good, and sit down and corner they laugh.
Welcome here at Sharp Primary Care. We are located here at Columbus, Ohio. That is 4889 Sinclair Road, Suite 103. We are located right in between 161 and Morse Road. We are here to serve our community in different capacities. We're here to take care of all your primary care needs, whatever you need, and also as you come here, if you need to be outsourced to different departments, different specialties, this is a one-stop shop where we're able to ship you to different areas of your needs. We treat an array of conditions, some chronic, some acute. Certainly, we're inviting you in this clinic. Allow us and give us the opportunity to be your primary care provider.
Sit down till the morning light. Your head on my chest, everything felt right. Now there's silence where your laughter's been. 2 hours drifting, don't know where we went. I see your shadow in every place. Still feel your touch, still miss your face. If loving me hurt, I understand.
Fambule! All friends of Koto we there. From Waterloo, Cruton Road, God rich, holy way. We come together, we the share the love.
not been the sick happen inside Maryland. Now them don't begin happen so. Me fumble them. Friends of Koto, they come with them give body water moonlight picnic. Saturday, June 27th.
Fumble them. All friends of Koto, we there.
And it will take place not the Church of Our Savior. Now 1700 Powder Mill Road, Silver Spring, Maryland. Friends of Koto, now people them. When them in the talk about moonlight today, if they know the day, na salon, you know the sweet. So they ready for bring to now memories of today. When they say moonlight, all what in they up in a moonlight, you go see them inside Maryland. They eat and drink them where they get for sale. Now moonlight price, and they're not there for heavy for your pocket. Come enjoy cassava bread and fried fish, Ajola style, of foot and bread, Deborah style, Bimto bread and butter, Babain style. Lord of mercy, because they want to make it look like how treats Quintana net when moonlight picnic in day. All them a junction go day, Lucky Dip go day, Abele go day, Coco go day, you name them. If you want no more, this not the name and people them where you go reach out to for ask question.
Road to the mountain them. We sing, we dance, we spirit.
Not forget, June 27, 2026, inside Maryland, Friends of Koto, with the first of its kind, moonlight picnic. Nadi Wadat.
One love, one people, we day together. Celebrate the days, we live, we laugh, we play. From freedom to America, we heart never fail. Friends of Koto, Daddy Moon.
We family them on our do Mina Ronnie Temple. They broadcast today, not all from Boston, Massachusetts, to they broadcast from New Jersey. Yes, but I want to welcome you all to the Hardwood shoot today. We get fine show for now. We can get a lot of fun, and also we will get time for logo educate yourself and learn a boku thing there. We'll be able to pass around to with family, we begin there, with friends, and with loved ones. So we get all learning for now today. So I want to tell you all welcome. Una don't can join me today. So do ya don't forget for press that subscribe button. Make you subscribe now. Share. Let you people learn where you go on for let's see. Let them self see. Let them can join me. Make we all can shape this today. Learn all that to we self. Like if you want for like also. Not a bad thing at all. But like we will know where to get today inside the yard to go shoot. So for push the program go before left, I go bring my co-host come where another person, but now this man we now Morenike. Auntie More.
Fambulem on a good afternoon. Bragoni, good afternoon. Fambulem on a good afternoon. Mina Morenike, Adena the Greensboro, North Carolina studio. I hope everybody they do okay. Fambulem on a see we're gonna need dressing for can welcome we guests today. Hey, Bogoni you swanko.
Tell you, I mean, I cannot tell family because when you come, you wait till you see not say the set. So now make me don't tell family, let them know what to say. Another tongue, me family. I didn't New Jersey because one my friend.
No, done.
Yes, one my friend will die. I'm buried in a camp, and I know Kande are still not find time for Ebola deal with me family. One na had good. So that make a pastor that shortcut. Say anything. Make a car appear na this road yard road. We no get them mommy no dey once I tell her do I go able for reach you sir. So now the reach I don't reach inside this studio. I pass that the yard road.
You do well. I saw you get buried. But really, when I see you first, I mean saying that we guests, now you dress so full. But anyway, I'm so excited for this show today. I'm so excited for this show today. Why are you waiting? We guess get for tell we. But Ronnie, I want to make Fambul know this. I get for say this before he come, or when he come on stage, I can say and save. But today your show, well, as all others show them, they not get nothing for do with politics, and we know they go, we know they criticize nobody in regime or nothing like that. I just want to put them out there, okay? So we'll get for Kayeri waiting we guests get for tell we.
Absolutely.
Over to you, Ronnie.
Out there. A better way put away make and clear. So how because my family and they are now go excuse more because it look like say my neighbor internet they use today. So all of they break on and off or they freeze. Now for long I know say something the neighbor not satisfied with her. It moving in round and go some other area. So when they watch you more.
You know, say we weather now, so one day cold, one day hot. All them days here, so all them days here we get almost 80 degrees. So it don't confuse the weather, it confuse the internet, Wi-Fi, whatever it is. So
because the weather mean the cold, it the hot. You want to tell me say the internet get fresh cold?
Who knows? Maybe not that. Like, you don't diagnose them already. So something like that. You don't get a diagnosis. Who knew?
I know. Well, yeah. Oh, welcome week. It's for this week guest
scam. Okay.
Yeah, it's really guest scam for you.
Like clear me to go for this. Humble them. If one member, we been joined we last week where we watched that Creole Excellence Award when they talk about mental health. The discussion been so good that at the end somebody chime in with say and get passion over this topic. Instead one for join in next where they talk about mental health because instead get in way one for share with we. Well, that person they 90 today, na yad good. I'm glad for tell una say today we get Dr. Amon Porter and at the backstage I bring and come like and tell una adu. Dr. Porter, welcome to Yadgood, sir.
Thank you. Inari hear me?
Yes, we hear you live and clear.
Yes. So, Monica, you want to make my takeover now, or I will follow you? You tell me what
okay. No, we will ask you the question, but first of all, I want to make you tell Fambul them Adu, tell them whose partner tongue you grow up and whose school you go.
Okay, Fambul them in our do Kushia for me and I can join we. For me and I can listen to me. Actually, me grew up na Central Freetown, na Pademba Road. We get family house na Pademba Road, right in the middle of Freetown. I there I grew up. And so elementary school, and then when we go to Tower Hill School, where they close to the house. So from Tower Hill School, I'll go Albert Academy. And then from Albert Academy, I come America.
Okay. Ronnie, it look like all of that they can at this show. It look like that's a while school and go. What's up with that school there?
Well, I think to say most of the time people who grow up in that central area there. Then you use that Tawai, Akibo bed area there. Then especially the one the Kidenia Pademba would so.
Okay.
Most of the time I sure say a doctor me the work out by himself for good school because you not get about traffic for past 2. So I mean the center. Not so doc.
Well, no traffic, like easy. And then before they go to school, they play football small. Then from Tower School, you one time Cathedral School where they play with the merry-go-round. So good memory. We get good memory then days the day.
Yeah.
Yes.
Okay.
And then tell them they say the color back. We not forget for Gobra and the color they take brown dust. More.
You talk about the uniform?
Yes,
Okay,
the
the
uniform.
uniform. I guess. Well, something and all that. Well, Dr. Porter, thank you so much. Before you before you come on stage, I mean, don't remind Fambul and say, let them know that say, and non-politics show this, and also we're not a bash nobody in regime. And where me and you been don't talk that anyway, so I just say put them out there. So, we not say the disclaimer, did it? Ronnie, over to you.
Yeah, so Doc, when you mean they grow up, in that area, I just want to let people, some people they don't tell them you, they don't remember you again. Not just bring the small, give them quick memory, put on a you so them go able remember. So when they go inside the program proper now, so man go don't remember, say, oh, now me and Mr. Potter, me, they in a class now. So them go able for follow because we get beaucoup people who they follow we because we don't change now, how they look now and everything, and we don't become older than waiting them, we for, then he miss me. He said, then there's somebody said, now tell me, I mix me, I say, now you know the Ronnie, I say, it's not me. It's a fiber more. I say, no, I just ask.
Yeah,
So,
no fever me, I beg.
When they can't give me that Ronnie, that's what I'm talking about.
They mistake you for Theo. They mistake you for Mauritian.
So, Doc, when you mean the corporate area, you mean involved any like then sports that you school to why take go the secondary school, any other extra activities them you mean they do?
Yes. One activity where I still remember, and not only one remember, people that, especially when I can go salon, people that can always remember me about that. I'm an actor. I mean, they act now elementary school. And one big play we get, now that play we say everybody we born a mommy born am. Every picking a mommy born am. I mean, big play down there. Women go on television, women then at city council, all the elementary school then at Freetown can watch that play. They say, beaucoup people they know me. So maybe they act. And then football business, I mean, they play football, soccer. Football, America will call it soccer. People from other country, they call it football. But I mean, left for play football, when they come up. And Albert Academy, what we did, we mean big part sports and all that kind of activity then they for run, track and field, we not the call run race. We mean good for run race business, we mean good. So Albert Academy, I mean good school, we meant to me for all the different type activity there. Even music. I mean, they play, they play with salon band. No, Albert Academy, then kind of things then there. So we can go to the music classroom, we go play with music, then so me upbringing in a salon not mean bad.
Good.
All right, that's good to know. At least for people and now them go academy or then we don't begin. Yeah, now the parties. We're not so extra post. Yeah, so now I want Morella hand over to Go ahead.
Okay. Sure. Well, the first thing we want for know, Dr. Potter, we know say you did at the mental health field. Waiting care you go in a mental health field. So many things in day for study in medicine. Why you choose that stream, the mental health road?
Well, what I mean the study, well, first I'm a job. I mean, get a job with the government like California. So I mean they work for social services. So while they work for social services, I mean go one training. Now I miss the trainer. And in the trainer, I say, they say you sound like say you're not a person who can do well for yourself. You don't make up your mind, say you want to continue school or you want to continue this job here. I say, well, if the opportunity there, I can continue school. So he said, well, what you make go, I mean, don't get me first degree, my bachelor's degree. He said, well, what you make go study master's in social work. So I said, well, that may sound good to me. So I go study masters in social work at San Francisco State University. So with social work, you can have a concentration in mental health, then kind of things than this. So from studying my social work, my master's, my advanced degree in social work, mental health looked very fascinating to me. Because as you know, Salone, we not can talk about mental health business so much. Now I make a glad for this opportunity where KDU embrace this mental health business. So I know me know about mental health. But once I begin study, mental health become fascinating to me. I like it. So I get my master's in social work with a concentration in mental health. So I continue for work small. Now I decide, say, well, I go do me doctorate degree. So I go na Norfolk State University in Virginia. So people that way the East Coast, they go know that place. It is Southern Virginia, even North Carolina. And all know it's
Yeah.
North Virginia Beach, Virginia
Yeah.
Beach. Yes, I go there. I go study. I go do a doctorate in social work with a concentration in mental health. So from then on, I get me license. Now the state of California, surprisingly, I mean, Veronica, after talking to you, I did look. I said, I get license there for practice social mental health now North Carolina.
Wow.
Because
How about that?
I'm in the team for move go that place. You don't tell why the team for move go to North
North
Carolina.
Carolina. Yeah.
So I mean,
I know.
apply for the license there. So I get license. Go ahead. Mhm.
Oh no, I be one say I don't know if you go like here so better past California because on a weather yonder wonderful past here so. Yeah.
California, dear. Oh, hey,
Well, that's
I
your
don't
own
hear
here.
the express business workout. California, I just they work for pay bills no more.
Well,
They go
that's not
ahead.
also you. That's not also these
Yes.
days.
Well, now the news that we just they work for America. People they don't know this, but we just they work for pay bills. So
That's
I get
right.
license for practice mental health now, North Carolina too. But
Okay.
primarily, my license right now for practice mental health now as a mental health doctor now California.
Wonderful. That's good to know. So the patients the way you they see what's in at the age range.
Good. I like that question because I mean they work with picking them, but I don't stop for work with picking them. Now they work with young adults, which that usually start from 18 to like 35, 40 years old. Yes, I work with young adults and regular adults, but I know they work with picking them. I know they do geriatrics. I know they work with older people, just adult and young adult.
Okay. So if you get patients with the don't they so say don't turn 45, 46, 47, you they refer them out? Is that
No, I
what
will
you do?
continue. No, I will continue to
Continue.
work with them, but I'm not
Okay.
going to take new case from geriatrics or
Okay,
new case.
okay,
But I'll continue to
okay,
work with them. Right.
okay. And with you therapy where you they do now you they no medication, right? You know they prescribe
No, I'm
medication,
not a
you know.
prescribed medication, but
Okay.
I can refer them to psychiatrists because
Mhm.
the difference must speak because America, because I know some people and they listen from Canada, some people and they listen from Salone, some people and they listen from England and all the other diaspora. But in America, mental health, you get doctors that you call psychotherapists,
Mhm.
but we're not a prescribed medication. And then you have medical doctors that you call psychiatrist, and then you prescribe medication. So me not psychotherapist, me not to psychiatrist, right?
Good. Another thing now, one-on-one session that you they do, or you can do group session.
I can do both. I don't do both. Yeah, so
Okay.
yes, I specialize in both, right?
As well as family therapy.
Exactly. The only thing I know they do couples counseling, couples therapy, but I
Okay.
do family therapy. I do Yes, I do group therapy. I do individual one-on-one therapy. Right.
I know say you license na California. If somebody in Minnesota right now, let's say a group of people in Minnesota, they want for do at the end of this, they want for talk to you, and want for counseling or something. with telehealth, now something where you go able to do, even though the patients they Minnesota, you they Obayanda, California.
Yes, I do telehealth quite a bit. But actually, the way America is structured, you can only practice in the state where you get licensed. So, and if I don't get licensed for Minnesota, I'm not going to able to practice in Minnesota.
If
If
not
not
the patients
crisis,
they okay.
yes, if not crisis, I go able to help them with the crisis and then refer them to a psychotherapist in Minnesota. But America, every state they license you, and you can get licensed like which I say I get licensed in California, I get licensed in North Carolina. But if I not get licensed in Minnesota, I'm not going able to practice in Minnesota.
Okay. So the reason we make you kaya so today, after me and you me don't talk from waiting you explain, I make you go ahead and talk. I'm waiting at the main thing where you want for talk about, where you want for make salon people then listen to you today. Go ahead, sir.
Well, like anything else, we're not going to start until we thank God and we thank Allah for giving this opportunity for more all come together. Because without God and without Allah, we're not able to do nothing. So I want to take this opportunity first and foremost for thank God and thank Allah for giving us this opportunity. Secondly, I want to thank KDU for giving me this opportunity for my talk about a very, very important topic we're not can talk about. Like what you have, we family that will not talk about, we not talk about this business here in a salon. And even we waiting at the diaspora ourselves, we not talk about this business very much. And mental health now serious business down there. From your own discipline, your understanding, even, and I know that this year will make a come back and talk this talk because I want to make people then disagree with me, look, get good conversation. From your understanding, mental health is even better, is strong past physical health. But when they concentrate on physical health too much, and the example I can give people them, you know, they watch television, you know, they see people and they work on a fire. Now, because of the mental health, we get in that mental strength there for me to be able to do it. So, where can you give me this opportunity? I want to talk about mental health today. I will start off by talking about general mental health, and then I speak specifically to trauma, because salon people them we don't go through a lot of trauma. Not only the salon people that with the salon, but we waiting at the diaspora too. And I want to bring that to people their attention, because some people that I can go salon or I can go work at a salon, and the people that I can talk to, them believe that as long as you're in America, everything fine. You do good, everything fine. So, but no, not in all cases, not to in all cases. So I want to take this opportunity here for talk about general health, so we all can understand them. And again, specifically, like I want to talk about some of the trauma where we don't go through in a salon, where they go through in a salon, where we don't go through in America and other diaspora them. Because trauma are funny thing. We, especially for us Black people, sometimes we talk about Black people, but we talk about salon people then. But this is generally to Black people, because again, people, I know they stay away from politics, but why they talk about this mental health business here, so it's very controversial. It's very, very so I would like for many people to disagree with me. Black people, we they struggle too much. Sometimes we they struggle with mental health. We not even know if we get mental health problem because we're not used to struggling. We just go no more every day with the things everything all right.
You think to say that because of we upbringing?
Well, the upbringing, of course. But we as Black people, the way the world structure, the suffering not they done for we. We are not care inside you day. Some places that they people, as soon as they see you Black, they don't let you. Yeah. The salon people they never for understand that, because they say when you're Black, when you're in America, you walk up on dollar, you walk up on gold. the struggle within I and not to America say, I don't go England, I don't do England. I know other place there, I don't do other place than Europe. I don't see that. So because of that, we just get used to that struggle there. So we know in the field of psychology, we call it resiliency. Black people there were very resilient. We're strong. We're not strong people there. God make we for me be strong. So even the adversity they come with, emotional adversity, discrimination, all kind of problem there, we still they smile. We still they enjoy ourselves because that's so God make we.
So, Dr. Potter, where you they talk about resilience and how people are how strong and the kind of things they will they go through because of them above things that you don't mention, where they get now different areas them. So now then because of the stress then they then keep bring unwanted experience to body they will not really want body need able to accommodate. Where it go bring we can to this trauma where they talk because me always look trauma like now unwanted experience where they bring depression. It's like open wound basically, where both internally and externally, where if you touch them, it go bleed, right? So make you look at like say easily for touch and trauma and thing way person way if we all pen yourself in a situation, we all traumatized. We all get something will take you out of the normal self for balance. We call trauma. We know all not able to recover the same way as we all go to it, and possibly not all man go recover. So now I want for just make you just educate me. What's are the different types of traumas them where they happen in a different situation in the so let people them go move for know exactly who they go to, sir.
Well, Rodney, what you say, you're absolutely correct. It looked like you don't study some psychology. You look like you don't study some psychology because you're absolutely correct. Because, well, trauma, but before I answer your question first, then I will go, because I want to define mental health. I want to talk with you exactly in mental health, mental wellness, and mental disorder. I want to talk about that. But what you say is absolutely not true. The analogy to trauma, now open wound, the physical, you're absolutely right. The physical analogy to trauma, now open wound. And the way trauma work, that the resiliency part, and you're right about that too. With trauma, some people then can be traumatized and be able to function everything to go okay. And some people then can be traumatized and it can lead to depression, it can lead to anxiety, it can lead to other complications, even physical complication. And then it can even lead to death. Because I tell you, before I come, I mean the thing about this thing here, before I can bring this talk here, I remember this while I'm small. This is like while I'm small. I'll taking I go salon now. This is not even before I even think of going into mental health. One woman women they sew. The woman women know how for sew. They sew for me, mama, fine one. So that woman they me say they married. So they don't get all the married dress, they know everybody. And you know, again, I know they give me age, but some days long, but even at the same thing. Because I go married in a salon 3-4 months ago. Married in a big thing in a salon. So the woman don't ready, don't put wearing white clothes, everything for go married. The man not show up. So that woman, with all the guests, the man not show up. The woman traumatized, he end up getting serious mental illness. You see, some people they go able to handle that and not end up with what you call psychosis. Women back home, we can say this person don't craze. Some people are able to handle them, some people not able to handle them. So it just depends on your level of tolerance, your resiliency, and your strength. That's hopefully right. I have an answer running in question.
Okay.
Yes, sir, you do. And yes. Go ahead, More, before I come in again.
Okay, no, now in minute talk about You talk about different types of mental health.
Come on, you want for tell everybody. Yes, you want say you want for done with the mental health before you go answer the question. But the different type of traumas, the way with the people in the Ghana tongue, the way they're exposed to.
All right. So well, may I get started? My start. Because this is a topic we're not can talk about Bernard Salon quite a bit. And even we within at the diaspora, we know they talk about mental health quite a bit. And we need for talk about that because now part of we health, mental health. So in America, we get a book we call the Diagnostic Statistical Manual, Diagnostic Statistical Manual. Now, this book here we they use for diagnose people them who they treat for mental health. It's called Diagnostic Statistical Manual. And this book, it defines mental health for we. And what's in this book say when a mental health is a person where they struggle with their cognition, meaning within the struggle with their thinking, then the struggle with their emotion, and then the struggle with their behavior. And when they struggle or deal with them challenges, then it can lead to mental health problems like psychological problems, physical problems, or developmental problems. And developmental problems are part of mental health too, where we not alone, we not let that be, we not embrace them very well. When picking, where we get picking, we're born with Down syndrome and then kind of things, then they with some mental health dysfunction. We can tell for hide the picking, we know they give the picking up good because we believe so other people then they judge the picking them. But that's not part of mental health. So again, I want to bring this to your attention because when they talk about them quite a bit, we are going to trauma for answer running question. Again, remember now that as long as you get some type of disturbance, and the most important thing about that is, I want to bring this disturbance where I don't talk so, with your cognition, which is your thinking, your emotions, or your behavior, this dysfunction here, it will cause you serious problem. Now your job, so it can cause you serious problem where they deal with your other family them, or it can cause you serious problem where they deal with other important activities the way you get in your life. So if you already say you fumble, then you get problem. Like for example, you drink too much, nobody know how make me, you cannot may deal with them. That's what saying you get problem. Where you accomplish, you defect people them, you get angry, you draw people them, that's a problem. You're not able to keep a job, no problem down there. So I will stop. I think someone can get question.
Yes, you mean the list that are the different ways then where people can get for identify, recognize problems them, some sort of mental health problems. Well, let we come back. You mentioned something earlier about developmental issues na salon. You think to say na because you think to say na because people they don't know the awareness not there for recognize then different issues then they. So now you make when picking they grow up alternately Allah then they beat them na school Allah panam say you too fool 30 day you know sabi 1+1 and you don't fail class 1 pass almost them. You know, developmental issues, whether not autistic, well, you know, we don't say autism na broad spectrum. Somewhere inside that autism that developmental they inside. Now because they don't know and how for bring and come to them. Waiting are your suggestion for the next step for bring the awareness and make them go able to help for them picking in there.
Ronnie and Monica, and they ask good question them. I really, really appreciate the question the way that they ask. Ronnie, I still not forget your question them. For me, I identify the different type of trauma. I can't go to talk. Okay. If I miss some, bring me back, perhaps. But I can't Monica question because a very important question, Andy. for make an answer. Again, yes, one people they don't know, and two, this is not the biggest thing. We also with mental health, I get for bring them up. The cultural differences, the culture where they salon is different from the culture where they America. I will speak about America because the America are very familiar with. In America, the practice. America, when you get developmental delay, learning disability, because the example, because Monica, as you know, you're an administrator in the field, so you can speak language where people maybe not able to understand what you say. So now break them down a little bit so people can understand. Let's say somebody get learning disability. You know, like for example, somebody go school and the way where the person they learn, because the way where they teach the salon, they're mostly theory. And with everybody they read and write. Some people not God not make people they made and learn that way. Some people God made and learn by practicing. So if you now God make you may learn by practicing, by doing this person, and then they teach you for write and read all the time. Yeah, they will call you fool man. They will say you don't know what you for do. You don't get any sense. So culturally, now the culture, and we need for change that culture there. And you ask me, well, what you can do for change that culture there? And again, we can start with this forum right now. Without them they listen, make them pay attention. We not get picking them. If the picking not get first, I don't not take first in a class. If the picking not take first in a class, the picking not take second in a class, the picking take 35. If not 35 people in a class, the people take 35. Not to me to say not no, you know, right away they beat the picking every time the picking guy they beat the picking. For one thing, that beats again. This is like a controversial side again. From your point of view, that beats then a physical abuse. Because women in small women they see the way when some parents them or other family and the beat picking, but then they mean they're close to slavery. You got to stop that. I mean, not tell people how for discipline and picking.
When we don't talk about that few months ago inside road, but for beat speaking, back then, that's no more they know. Now that's no more with people they know.
Now
Now
the
make them in the
culture,
beat
yes.
They don't be no better. But what we all don't care so now we don't learn, we don't know say not to the right way that one day, or that way that we can teach picking something. So yeah.
Yes. So but for answer your question, because me no one go on the beat side, and then which I say I don't talk about that a separate topic and but the mental health side, that doesn't mean mean say because that portion they take 35 in a class, that portion they not go grow up to full potential. You don't mean that. Again, this come back to the trauma part. Part of for treatment for trauma is as long as you give that picking the love, you give that picking the encouragement, you encourage and say, hey, okay, low try, low, she did not 35, low sure I can help you be 30 tomorrow. What you need for maybe 25. You see, as long as we're able to do that, now part of the treatment down there for trauma is trauma, you get for show love. You get for show that person, they say you care. Because that person, they don't go through, just like what you Ronnie say, it get big wound. If you serve the beat your person again, you they add to the wound. But if you they talk to the Pekin, you they nurse the wound small, the wound go well. So, yeah. So,
question, Dr. Porter. For somebody we don't grow up with that trauma, it don't go untreated. Now you don't become a full-grown adult. It then in 40s, they go 50s, whatever. Help they for them at that point?
Absolutely.
Because plenty people and they will not know that. Help they. Waiting at the help, waiting at the first step, wait there for do.
Well, I will go directly, just for answer your question, I will go directly into treatment for trauma right away. I will go into that. Because but before I go into your question, I'm going to Ronnie in question. Ronnie, you may ask what the different types of trauma.
Mm-hmm.
We get
Yes,
what
sir.
you call, Monica, don't forget a question or at the camp,
Okay.
at the end of the question. I want going to run in question quick. We get different types of trauma. Uh, the first, we get what you call acute trauma. Monica, you know about that because you didn't have and all the other people that we did listen within the health field. We know what acute is, meaning that you either they experience the trauma right now or you just experience the trauma. You just experience some acute. What you call chronic trauma. And with chronic trauma, what you mean is you just about the example where you give Monica, we're in the beach between all the time till you become adult and say, you know what, you don't tire about this beach here. Now chronic trauma that the person just to continue for endure this trauma, now chronic trauma. Then part of the thing what I want to talk about again, now what we call generational trauma. Generational trauma and a trauma with a lot of people that will go through, people that know they pay attention to them. Or they not like just what you say, they don't know for me they able to pay attention to them. Generational trauma, in a way, trauma, they affect one generation, it'll go to the other generation, it'll go to the other generation, it'll go to the other generation. And for what me see, for me travel in a salon, beaucoup people them, just like what you run, he says, some people can able bounce back, some people not able to bounce back. And also salon, really, we're very resilient people. We they do well for treat with trauma. But from the war, that war we start 1991, that's civil war. We start in salon. We go through some generational trauma from that war. We meaning we family and they go through that generational trauma, we were not able to bounce back from them. So beaucoup people not able to bounce. Some people do well. But and when I say another top one was a family with this salon, but even we were there at overseas, we were there at the diaspora. I will bring example to now. Me na no say we self now we dey struggle with that generational trauma there. So not to just salon people them. We are salon people them. Period. That what it really unbug we quite a bit. Then the three type of trauma that I want identify. So I can answer your question. Ronnie not lost your question. No. I want to answer Monica question. If Monica asked me question about treatment. And treatment, really, when you talk about for treat trauma, like what you say, I can go into right now. One is that, and again, believe it or not, so some of them treatment and again, I want to say this, not to say I say this in being conceit, but I say this based on my training. Me a doctor, so most of the thing what I talk about is based on research. I just don't want to talk just for the talk. I should get a PhD, then PhD the way there on the, because I believe so we'll get some MD, PhD people there. Don't go understand what you do. And in our way they work with doctors. We know they talk no more for talk. Most of we talk that we call them evidence-based, meaning that they don't do the research, they don't prove. Saying that this thing here then the so I want to say that for answer Monica in question. One of the things that we'll get for do as for help people them is that we get for let people they know well one treatment that we they do right now. Would they talk just the fact that would they talk about people can able to identify the problem if they get problem and nothing for do with what that then are one of the treatment. The other treatment what they look at is that we get for give people them the opportunity for me, we get for empower people them. We get for give people them the opportunity for me, then we call it empowerment. Again, like until I don't tell you now somebody see what they talk about, it will be very controversial. Because when they come, you give people them salon. Let's take salon people there for example. Salon people them where they can call, they say, hey, boy, big, send me money all the time. Where they send the money, they empower them. They enable them.
Enable, yeah.
Yeah, the difference down there, they enable them. So when you enable them, then you where they send the money, you're not enabler. Again, I use American terms, then please, I beg you now, forgive me.
Yes. We understand. We know.
You're not enabler, you enable the person. But when you empower the person, you give the person the opportunity for me the person able help themselves. You see what I mean? By that, for example, let's say you get that person the money, say able start business. When you know me, the struggle now, start business. And if that person able to start the business will have it better. The business they do better, small. That means that at least you empower the person. You see? So now one thing that you get for empower the person. Another way where they help people them with trauma. Again, this life I will get, and it's very common with mental health. Everybody get choices not in life. And you got to let them people then they choose the choice the way they want. Like for example, myself now, I treat people that with substance use. I will talk about that kush business. I beg you, give me opportunity to talk about that big kush business. I'm certified as a substance use counselor. I teach people that with substance use. And one of the things that what they teach people, you get choices. We all get one life for live. If you want to choose your life for use substance till you die, now your choice. If you want to make my help you, let you get a more productive life in this environment before you die, now your choice. So you give people then the opportunity, we call it self-determination. We encourage people then for me then make that determination day. And another way is which I do right now. I got a lot of respect for it now. In collaborate because this will agree with me. This especially England and America are very lonely place. Lonely place. So thinking I can do all day by myself. Now make what I can do. I very seldom they do telehealth because yes, because I like for they around people them. I not like for.
Oh, so you're not people's person, okay?
Yes. Well, no. You say me not people person, which is true. But according to mental health, we as human beings are socialized beings. One of the things that will bring you the greatest health. Now we socialize with your other people. Them one of the things that will cause you the major mental health problem, which definitely the specific type of problem, not depression. Now we do by yourself all the time. Now make when they lock people them, they put you in self-confinement. They know it's not mean. When they put you in self-confinement, 3 months you don't craze. Because God not put we in the position for me. God not make we for me day by ourselves all the time. God make we for me day with people that all the time. So now one way down the way with the help we serve for deal with this trauma. Because even myself I go salon, then one of the reasons I make I can left salon. Because I go salon, I get people around me all the time. Why the America? Nobody know I can. If possible, I can see you, then they call you first. Say, Bobaka, you go to see the. I'm not sure we schedule busy in America, but we culture in our salon is a little bit different. So socialization is big. We call it social network. As long as you get positive social network, it will help you through trauma. So last.
Yes, sir. Waiting, I go really want for add. And so it's me Pambo Lementi, all they listen to Dr. Potter. This is an opportunity we don't get for make we all go able for take a lot of important resources from this. I make good use of within with family and all, and I know say Dr. Potter will agree with me. Some of the I really talk about acute episodic trauma, which is where they under way. You dey talk about acute episodic trauma, you more basically they talk about natural disaster that will happen, like we talk about like the war will happen, then things and they all happen, Ebola, COVID, then natural stuff that they bring acute episodic trauma can where people you just witness, you see somebody person, they just die that kind of way they or something happen time or any of them thing they happen time we not comfortable with you. It can stay with you because you were able to they think about that person all the time. That memory they get flashback and then they stay with you. That in a acute episodic trauma where they go. But one other thing we I feel to say you go find for we listeners they all fumble they all know let them go able keep them now then toolbox, for just make sure say they able for understand the family members them and for able for know waiting are the signs and symptoms of acute for trauma basically. Because we can see down there so many times, and myself I don't say so many times where people we would see say picking you get poor concentration. Because of that poor concentration, they instead of be supportive to them, we can just feel to say, they pay attention at school or anything, and they so we go get punished for that. And then there are signs and symptoms of trauma. Some people and they before you talk to them and they snap really quick because they're vexed, they're so upset. So too much, if you look and say you got anger management problem, no, trauma can relate to that as well. We can look at some other people that we can see where then get all time you talk to them and say they're tired because of chronic fatigue. Anytime you talk to person, the first thing you say, oh, I tired. You just wake up, you tired. You see, so then thing and they always people like can get them to go through what they see. We not intend for understand those side in the common form. Now make it very good for make we able empathize with people them. So we able for no side in the common, we able for be supportive to them. Just the kind they talk about the way we able for help someone for get out of trauma. You get for engage the person because when you engage the person, you get for able bring out to socialization, like able for socialize like community, you able to talk to people them, and then they get all in this. So you go find out say the person go able bounce back, you go come around and able forget things right. But Doc, I just want to make you continue with some of this trauma they talk to. I just want to clear that part of people they say. And after that, we'll go take a quick break, then we'll come back. More over to you.
Okay, I'll drop off the call just now because somebody called me. The person member say I dey sleep. Not to sleep, I dey sleep. Oh, I freeze. He called me, they tell me, say, me the sleep. I not a sleep, I want make fumble and no. I just want to put it out there. Now freeze me internet they act up today. So now I want to talk about mental health. Now that's it to me Wi-Fi. But anyway, Dr. Potter, we were then at the diaspora. And me don't go to them a lot until I learn within at that thing day. I know how for control them. I know say I get a little bit more happiness now. Plenty people and they go through that. When then they ruminate. Rumination, they make people them almost lose their mind for sake of something way not even worth nothing. Do ya help we tell we what we can do for make we left for the ruminate, how we can break out of the atmosphere there.
Okay. Well, at the Bernica, I will start with you, then I will go back to Ronnie. Ronnie, I want to continue that conversation the way you may stop. But
Yes, sir.
I want to identify the different way we can identify different trauma. But Monica, back onto your question. The way we meet to do therapy, as the way we meet to practice, again, we get different psychology. Really, I will start off with this. Psychology, we call psychology a Eurocentric medicine, meaning that now mostly now which man them now from Europe that now then really they do the research, now then really they pay attention to psychology. We as Black people, they will not pay attention to psychology so much. So most of the theories, most of the research, most of the treatment, it's the same thing with medicine too. Most of the medicine and treatment, they come from white man. Although we get few medicine where they come from Africa, but most of them, but I will stick with psychology. Most of psychology, most of the theories, most of the interventions. Now we call with treatment interventions. Most of our interventions come from research where white people then they do. You see, so yeah, so really, the way answer for Bernice, for answer your question is we as Sierra Leonean that we farm with them, we already they treat we self and we don't even know self, so we they treat we self. Now the interesting part and the part, yes, we already they treat we self, but me know because me know the psychology, me don't read the research, me don't read the theories, waiting and say. Like for example, Salomon, like you say, Salomon like enjoyment business. When you know Salomon like enjoyment business, a treatment.
Yeah.
Treatment to psychological problems. Like you say, Salomon, I shouldn't want put music the one dance. That's treatment. Which man and the struggle with that kind of business then they
Yes.
right now I watch video the market. The person come with the music, Christian take come with the music, if they play music, people like everybody don't stop, they know they go back it again. But that's business and that's treatment. That's treatment. You take the mind off your struggles, you enjoy yourself. Not treatment. But the research, which man and the struggle with that, which man music, they don't know they pay attention to self, then they waka, then they go. So the research they tell them, say you as the psychotherapist, tell people that make them dance, make them listen to music, make them enjoy themselves. But me not get for tell Salomon that. Salomon know that. But treatment. You see, the other thing and the way I talk about when that treatment, I can tell me because me they teach school, I teach California State University. I can tell me students them. I say me, where they salon. All I get for do now for she don't do. Everybody where they go market, where they pass na treat, then they stop, then they talk to me. At least give me 5 minutes of their term. Not treatment, not socialization. You see that? So we know how to treat ourselves, and with the treat ourselves. Now I make the problem, really the mental health problem, not so pronounced as alone, because we know how to treat ourselves. The intervention where the weight man and no research when they do for themselves, for we now automatic business with the do am. Another one thing again, when a treatment, I beg in about talk about this so now spirituality.
Yeah.
We not alone, we embrace Muslim, we embrace Christian. And which I notice working go salon now why beaucoup people them then can spend beaucoup time at church, then sometimes and they go church Monday, Wednesday, Friday, and then Sunday. And people then they go to mosque Friday, Saturday. So that spirituality aspect, not treatment. Now the best treatment, actually, I know don't go too much into spiritual, and I don't go do that because not to me expertise that. But waiting the research shows is that the number one treatment for trauma, not spirituality, because it gives you hope that things are going to get better, things will get better in the future. I say that so spiritual leaders then they listen to me, then get to understand, say what thing then they do, then they provide treatment for them people them. It's very, very important. And no matter, because it no matter if you join organized religion or you do personal treatment. Because in America, we can do personal treatment. We do meditation, we do yoga, we do them kind of things. Then the salon, we not embrace that culture. Most of the culture where they embrace spirituality, now organized religion. It no matter.
If somebody say right now, well, I make a they smoke marijuana, not treatment. What do you go say to that?
Well, you know, now controversial. We still they deal with that issue in America. Now, big controversial issue you bring. So, because especially be patient the way they treat for trauma. They can say marijuana, they relax me, and they smoke marijuana. But really, to be honest with you, anything, okay, now good question. So right away, they can't answer that question in a different way. They can answer that question in a different way. Because you know, people like you say marijuana now are the smoker for relax me. But anything where they alter, where they change your natural self of being you, good for you. Because I will tell you why. You know why? Because God, again, for begin talk about God because we not to pastor, but spirituality relate to mental wellness. Spirituality relate to mental wellness. Which have the point I make, God give you all the things the way you need for make you enjoy life.
Mm-hmm.
So you don't need for smoke marijuana. You get the hormones where they give you dopamine. It'll give you dopamine. It'll give you serotonin. It'll give you all the things the way you need for make you enjoy life. So it'll give you what we call parasympathetic. God don't give you all the things then they. So the minute you start adding, now make alcohol not good for you either. Alcohol and marijuana, they all not the same. The minute you say, okay, well, why I don't drink, I will enjoy myself good one. No, really, you don't lose control of yourself.
But doc, we get some doctors them we I don't see when the documents get when they can talk and stuff now some network them say then they use marijuana for make medicine. Would help some people there with pain and all of them things in the and we get some people only they take up and apart from the recreational marijuana, so like the people who they use say now for medicine for heal up them pain and all of that in the what you go see to the one in the
well, I don't want to contradict physical science. I don't want to contradict physical science. But at the same time, really, when you come down to them, really, especially we were the America. This again are part of the things that I can teach my students. We were the America. Then doctor, then they lack for giving medication. By the time you turn 50, 60-year-old in America, you take 6 medication a day. 6 medication. Believe you me, the people that were the salon or older, I know they listen. Try to tell you so. And the research, it's been researched. Now, psychiatrists, why they take me psychiatric class. Now, most people in America today, by the time they turn 60, they take 6 medication. Unless you tell the doctor, say, I take the medication. Doctor, they give you medication for your mental wellness. Then the doctor, they turn around, give you medication for the side effect of your mental wellness. Not too much medication, Andy. Yeah. So, what to me, they say, I don't want to contradict physical science, but for answer your question, really, again, I'm going to spirituality again. But the Buddhist theory, I know Salon we know they embrace them kind things, then they know the team but then kind things, then they. But America, where would they do this work here? We get to read all them kind things, then they. So I beg. But the Buddhist principle of mindfulness, if you train your mind, now the point I they tell you so, you get for discipline. If you train your mind strong enough, you can able to overcome some of them problems, then they, especially things like pain. And with pain, it's funny because we went and trained when I'm doctorate school. you know what disagree with that person in pain. If that person is in that pain, you get for respect them. Because not you didn't that person in body. So if the one take marijuana, the person said the marijuana, they help them, fine. But one of the ways they want no marijuana, they help good. Now, like people that will get cancer, so it's sometimes when they can take the treatment, they're not able to eat. Because one of the side effects of marijuana is it make you angry. So marijuana can help you eat. Again, just no more like anything else. Again, good, again, bad. But if you take on recreational, sometimes you can go against what God already don't give you. Hopefully, now tough question they ask me so, Ronnie, not a joke question. tough question.
Question for you, doctor.
But Doc, I think you answer well, sir. I think you answer well, and
thank you.
Mr. Self able for learn from that now. Self say, where person do you where doctor prescribe you medication? It's good let yourself you get second opinion by doing research, because if they use medicine for something, let's say mental health, then they give for side effects, then they're a flag. What for able for look? That means to say if the side effect is too harsh for me, I need for take medication for that. That means the medication they give me for that particular thing they for be reduced. And I'm waiting me take on that too. Me not a doctor,
but I can encourage you to run for make and take one step further. Talk to your doctor, boy. You see, we learn, especially we in America. What you know more doctor? As long as that person in a doctor, what in the person saying a gospel? No, not a gospel. Talk to your doctors. You don't talk to your doctor. If your doctor no one talk to you, then go find another doctor. But you don't talk to your doctor. Ask the doctor medication. When you go to the pharmacy for pick up the medication, talk to the pharmacist. Because pharmacists in America, even the pharmacists that were Mr. Salon, there's no medication, good one. Talk to them. Ask them about that medication. Just don't want to take that medication and see. And so you can take the medication, you know they upset, but because now the doctor don't prescribe them. And then finally, like what you say, do your research. But as part of the research, talk to your doctor, talk to the pharmacist. And so thinking especially you don't know by me overtone of this. Sometimes then doctor they within at the diaspora, depending on which part of the world you did, they're not going to care about you too much when you're a black person. You have to remember that. Because you are the regular person. Yeah, go ahead.
Yeah, I got a question for you. Come back to therapy. People and way at what point when somebody they come to you as a patient just for therapy, whose time you they begin to say this person it don't heal or it don't need for graduate for left for can to me. Whose time they send them on the way?
Well, and with discipline, we they look for functioning. Now, functioning, what they look for. If that person in social functioning has improved, occupational functioning has improved, emotional functioning has improved, and behavior has improved, then we can send that person there. We can close the case and send the person on the way. I don't know if the answer too broad. I need for be more specific, but we can look for functioning. Like let's say, for example, I will give, because sometimes you can good make an example. Let's say, for example, this person they deal with depression from something what happened at this person in life, okay, and I treat this person from depression, and now as he said, the person, the spirit don't improve, in mannerism don't improve. It show say now it feel better, it feel good about himself now. It be around people them. It don't say I don't go back. My disability don't done. I don't go back to work. I don't go back for work. I dey work everything to go all right with my friends, and I work then say, I they do well, then kind of things, then they and emotionally, you emotionally they do well, you know they let the problem bring you down again. Then we can say, okay, the way we like now the same thing with medication. We're not stop completely. We can say,
Okay.
okay, let you go, then let come back, let meet once a month. See how you do.
Okay.
Once every 2 months, how you do. And then from then on, we can close the case, say, well, if things turn again for you, you can come back. But some people, then here will go forward. But again, quickly, I want going to running question. How do you how you going to say you deal with trauma? And again, from the research, then get several questions that we can ask people then. And I just want to bring this question. I just want to read this question here for me people and think about this question here. But no, if you just experience this question, let's say the answer is yes, but they happen very often, you're okay. But if nothing where they happen very often, then maybe it probably will bring concern. Like, for example, if you have memory of stressful events all the time, if you continue to remember stressful event all the time, then maybe problem with it. If you did, again, dreams, I know dreams, if you get, they say disturbing dreams, but if you get frequent dreams of disturbance, of fighting, and all that kind of things, then the problem there. Stress, if you experience stress, when you talk about anytime person say attire, then they pay attention to them, problem there. Also, if you experience trouble with your memory, you forget things frequently, long-term memory, short-term memory, problem there. And again, if now 1, 2 time, or you forget things, but if it happen all the time, problem there. If you're not one of the negative people that way everything now problem, you get negative belief. Every time you talk to people, they know they see the good part, nothing. All they want to talk about the bad. And again, we family that will get problem like this. So I don't know if they're mental health problem, but with people so because what is the salon? I can hear that. Saloma no one good for your other Saloma. Problem there. We get for stop for think about that. Which man then they support themselves. We get for start for me support ourselves. Now the only way down the way they go before. And I mental
How
health
for
problem
start?
that way.
How we go get to them for start? Waiting at the first step.
Well, the first step, first now for recognizing a problem.
Mm-hmm.
Because they're not even one recognizing a problem. As soon as you talk about somebody in good one, they don't change them. But that person did not this, not that, not that, not that. So again, no problem. And you see how we go change that. But one way for change that, I for say, hey boy, glad for that person they want him.
So now for call them out.
Yes, well, but now, you get for do them in a very diplomatic way. Not to say call them out.
Yeah.
Say, hey boy, but that person they with the way they struggle now this warrior, a good way one of we, two of we they do better. What you now for do now for encourage that person they don't do better. Say may do 1 or 2 things for me uplift other people there. But right away they want to make myself jump in that bandwagon for all this negative belief. Change them to positive. The way change them to positive, do it in a nice way. Well, okay, yeah, I understand what you say. One of the things that will believe by mental health, what the person say, validate that. What I mean by validate is say, I understand what you say. Mm-hmm. But you know what thing? Me applaud for that person there. And now it's my own job now for encourage that person there. Tell them that person they know say I'm glad for him. Encourage that person there. Let himself use what he get. May uplift other people them. Let me now, so we give me this opportunity for Mark can talk to now. I know say some people there, some of the things that I say that disagree with me, bad one. But that's okay. I respect
them. If una disagree or una agree, una put on the comments, we go read them. and Dr. Potter go answer on a question them. Continue, sir.
I agree with that, but you know, just for give me that opportunity today for me to say some things them as a professional in the field, maybe one or two people then go benefit from them.
Of course.
Yes. So now down then the other one. The other one is for example, you go through something where they cause you like natural disaster. Yeah, then you experience natural disaster, then kind things, then they no problem. Yes. You experience things like especially we were the salon, we don't experience a lot of natural disaster. When you talk about some of them, so I know they talk about them again because I know why we traumatize people then. But if you don't go through things like fire, the other thing too where they cause a lot of trauma in a salon right now, where beaucoup people are not to pay attention to now transportation accidents. And not only transportation accidents, but accidents, period. Me don't they saloon, then keke, then motorbike, then they get every time they turn around, they say somebody die. What do happen to that portion? That portion they may get accident na motorbike. That portion they may get accident na keke. And then the portion where they tell me it is trauma for that person, and then the person, part of the reason that led to the person will lead to the person for die, not to know about the physical problem, but the trauma of the accident.
Yeah.
Me don't again, exposure, physical assault. You talk about that, Monica, where they beat person all the time. And I will give you this example, and Monica, I will take your question. I deal with one of my family. This is not my blood family. I know they go into details because we believe in confidentiality. I want to maintain confidentiality. I deal with my family. Now I talk to him Pekin. Now ask the Pekin they overseas now. I know they say the country either because of confidentiality. Now they talk to the Pekin. I say, you know, I go salon again. And the Pekin say, no, me no want go salon again. I don't want nothing to do with salon. I think say the Pekin me they 8 or 9 year old. 90 parent, I don't again confidentiality. Then the parents say, well, the reason what you make, you know, they want go salon again. Now because one day, I mean they look now window. Now they see people then they fed. One portion they take bottle, take knife, they choke that portion there, other portion they take thing, they beat that portion there. Serious violence. Now in the Pekin see. The person, me as a trauma expert, me as a psychotherapist, me as a psychologist, right away, way broken down to me. I say, oh my goodness, that Pekin, they don't traumatize that Pekin there. I make no angusa. But the parent, you don't know. It just they laugh. Now we see them the fed, then they choke themselves, then they do all these things. Now I make no ango salon again. You see, so physical.
That's serious. So for the one that with the inside tongue right now, we not say there is no way. There is no way where we go able, all man go able to get therapy, treatment in a salon. Because in one way or the other, they all don't go through trauma in one way or the other. How for help them, Natong? Whatever.
Well, in they do the right thing. And now for continue this conversation, continue for make people then become aware of the importance of mental wellness. And not only continue, but broaden the conversation a little bit. Because, yes, broaden the conversation a little bit. Let's go into substance use, for example. Look, salon. Look, sometimes I can go salon, I can tap na beach, Lumley Beach. I don't know I don't know how many people don't do around Lumley Beach. But Lumley Beach, them bobo them not to come on kush bobo them did it. Not to come on kush bobo them. Sometimes you can just sit down and see and kush now what you call depressant. Meaning that you just sit down, you don't get nothing for do, you fall asleep, you don't nod, you know they make you active. You see, and I can just see, believe you me, I can waka Akiwaka go na me gym inside the exercise na Freetown na Lonely Beach day. If you can see the number of boy that we sit down at the beach, strung out. Well, I don't know if strung out na English word. I don't know. Under the
we know what you mean. Yeah.
Strung out on Kush. And this now young boy them. We actually, back to your question again, we'll talk about developmental trajectory, because we according to Whitman science, all of us therefore go through developmental steps. Like, for example, if Pekin 2-year-old you know begin work at it, that for then they go tell you say so, because our developmental steps then they go tell you say something wrong. If Pekin reach 5-year-old, you know able to talk yet, now developmental steps then they for tell you say something wrong. If young Bobo reach 18 years old, you know start for begin think, say, I need for be a productive person in society, I need for engage in a relationship, I need for be able for contribute towards my family and all that things, then they and just you don't know more, they do kush and they beg for money. That tells you something wrong. They're not a meet in I would talk for America. In America, we say they're not a meet then developmental milestone. They're not a meet, that means there's something wrong.
In salon these days, and it's what we on tell them all. Inside the last few years now, then young man, then you don't turn 18, you don't sit your O level, work no day, nothing no day. I know they said them for go do cushion, not so that me point that one day. But when they talk about developmental, you don't 18, you don't know what next for do, work no day. All what you learn at school, work no day. What you go say to them people in there? How them go able differentiate them now developmental make they think of waiting for do next or not because hope no they say go able to work.
Great question. Okay, first I'd answer your question backwards. I'd go behind and answer your question for come forward. The theory of hope, the way we define hope in psychology is that hope comes with opportunity. So if for you for be hopeful, you get forget something where you look forward to. For you for be hopeful, you get forget something where you look forward to. For example, I'm hopeful today because I look forward to people and benefiting from my information. Now hope that day. And what you they say is in Salon right now, people not able to be hopeful because they don't go school, work not day. But you know, at the end this talk all the time na Salon. At the end this talk all the time na Salon. But you know, the way God make we, and we mean human beings, period. Human beings. The way God make we as human beings, we therefore be resourceful. We therefore be resourceful. Not just you don't know more wait for me pushing you work. You start thinking of ways where you can able to do something for yourself, for make you better yourself. For example, I will give example. And again, I just give example no more. I'm not gonna answer your question till I will able to solve this problem, but I'll give example. But farming. Well, farming is easy. Let's say, for example, me now. I not say this example correct, but I give example. Let's say me now, I get farm back home. I said the person say work no day, I don't finish college, all them kind of things, then they work no day. I said, okay, well, might give you small money, buy 2 cow. 2 cow, believe you me, if you get woman and man cow, in the next 12 months, you don't get 20 cow. You see what I mean? I know they say not the answer that, but truly, I will speak on this because this is research and it's proving the reason why to make America become successful now because of agriculture, farming. But you know, we embrace too much this business. We all want to wear a necktie. We all want to be doctor. We all want to be professor. No. Now make some people then successful now salon because now business people them. And some people, as long as you embrace business, you try. If you try and you fail, now different thing than at least you try. But if you just sit on and say work no day, work still no good day. Because the condition, the country will be, this is my opinion. Again, this is my opinion. And I don't know.
Yeah, I understand that. The example where you give just nobody cow, I can hear people in now in Impala. They say, well, okay, you say if you buy cow, you get one man cow, woman cow, inside 12 months, you go don't get more cow, because they go don't produce. Inside that 12 months, they waiting that person they eat. First of all, now the cow they go sell. So how will they produce this produce?
Well, again, I go answer that question there. That question there I go answer. If the person go sell the cow, that tells me say that person they get problem with reasoning, they get problem with the cognition. Yeah, but if the person say, okay, Monica, I appreciate that 2 cow you give me. We don't get her now. We don't get the cow. We feed the cow them all them things. Then they, but let we work together. Me and you work collaboration. Now treatment for trauma down there. Collaboration. Let me and you work together. But help me small. Low getting cow then shouldn't cow then go get picking them. And then what them cow then get picking. Then whichever way me able to help you, then we go able to help you. We help ourselves. But the minute we talk that talk day, me and you talk that talk day, and me, you help me, and me not help you, we get problem. We get problem with cognition right away. But if you help me, again, maybe me not go there in the position for Mark help you more than which you can help me. But if I show appreciation, take this short hour well so. This short hour well so now salon person so on for me. Because they appreciate what I do for them. Yes, and then give it to them for free. Because now true talk I tell you so. Because they appreciate what you do for me. And believe you me, I tell you, say this not true talk, I tell you so. I help the person buy sewing machine. And the person they sew right today. The person can call me say, say, well, this month your business slow, I'm not able to do too much. I can help out. But not to say they call me all the time. And if somebody they come, it is so me nice clothes that the last time it show me hat, it show me bag, where I able to give to my friends them. So that's what they help we serve. That what that tells me say that person in cognition, in reasoning skills, if they using reasoning skills. But again, that then a part of neuropsychology. I beg my finish this wire and then I can take on that question. It's part of neuropsychology. Neuropsychology, what in neuropsychology they tell we the difference between we and animals is because we use with reasoning skills. The minute you stop using your reasoning skills and using your limbic system skills, you operate like animal. You see, if you send me money for my start business, I eat the money. You send me money for make a bill host. For me, you supervise that business. For me, you eat that money. You behave like animal. You know, they use your reasoning skill. Right away, that tells me your thinking is aligned with the way lions, tigers, and all them people and they didn't think. You know they align with the way other people think. If they align with the way other people think, you go say, okay, this year, now they me bread and butter they come out. Now they me family they come out. So let me pay attention to that. And again, how do we do this? We got to educate people them. Because beaucoup people they don't know that in salon.
Yeah. You know, say on a lighter note, you know, say more on diagnosis, not being a diagnosis.
Yes, of course.
Yes, plenty people they don't know that.
Yes.
So when they if they call somebody say in a moron, technically it's not to cost them cause you know that being a diagnosis. But anyway, we don't get some comments them, and I think a couple of them are questions. Like put them, like read them out so you can. Ken Ham say he said the effect of all this war na the world today? I don't understand. Okay,
No, I get the question. No,
you
I
get it.
understand the
Okay.
question. I
All
understand the question. The question, just to boil down the question is saying the children are being impacted. Well, you're right in English, so I will speak English. I'll go back to you. But what the person is saying, our young children today are being impacted by the war that's going on globally, all over the world. And the behavior at school, and it is shown by the behavior at school.
In a school, okay.
Yeah. So it is shown. And it's absolutely, the person is absolutely correct. Wars are not friendly to human beings. We're not meant to destroy each other, and it does have a traumatic effect. And to answer that question is, I don't know if this person would put it if na America idea, but if na America
Canada.
Okay, I'm pretty sure Canada is the same thing too. You have school social workers, you have school counselors. I will encourage you for make this that wonderful topic. For me, talk to the school counselor or talk to the school social worker so they can start having group, then can begin to have group therapy.
Yeah. Okay.
Bring these children so these children can process what they're going through. Because quickly, Monica, I will come to you, but this is a good question. Because what you see on television is very impactful. Now, some of them things now they're the trauma in the commode. And now with social media, even make them worse. Yeah, because social media, they show you the exact brutality of human beings. And then some of them picking there, they're exposed to them kind of things, then they affect them.
Okay. Thank you very much for that. Dalinda Harrison, when I'm his sister, it say hello to we. It say happy for watch we. And it say Dr. Potter, it say you the teach we how for or the April for identify some of them things there. So he also say with the experience, he say we're all experiencing these ourselves, family members, even around us. He said, look where how angry some people can be. I know we go on social media now you see them. Then Ronald George Stone say, unfortunately, he says Sierra Leone lack all of the above psychological help them. This is not the one that you've been the call before. He said because hope is absent. That's deep. That's deep. Hope absent in a salon. It's sad. And a couple and say mental illness na very important in our country. It say if you go na the mental hospital na we country, it say very sad. It say na only good people and they donate medication. Sometimes them na the hospital.
Can I speak to that one real quickly? The hospitalization of mentally ill people. Because, and the reason for this, it begin back to where you will start. Because we not value mental health as a culture. We not value mental health. And the funny thing is, Whitman and see mental health as very, very important. I'll give you an example. I'm the fly from Jamaica to back to America. And I'm the fly with this Ghanaian person who sit next to me from Jamaica. Now the person asked me, he said, which is my profession? Now I said, me a psychologist. The person tell me, well, no bother for Africa because we don't need you there. That the exact word. And he said, no bother for Africa because we don't need you there. But don't forget, this is not Ghanaian people. And Ghanaians, they don't experience the trauma where we experience. So, but I just listen. I paid attention, but I think they resonate with me. I was traumatized with that statement. That make I still remember I'm up till today. Yeah. Say no border for Africa because we don't need you. It's very sad.
It is sad. Walter Cummings say, he said, Dr. Potter, he said nice to see you in the career forum with your print waistcoat. Yeah, it is talk about.
You fumble.
You fumble.
Not fumble. Now me first. and we go way, way back. So he can call me all kind of name, it no matter, I go take out.
Okay. And it talk about the socio-economic problems. He said the multiple. I guess he want for saying that we country, but that statement they not finish. Let's see. Usayade Dana Waltina Cummings. Okay. Then the next one na Dalinda is say the way I will see things na this generation. He say we are not fulfilled. He say we are lacking in something we cannot identify ourselves.
Well, let me speak to that. Hopefully, this conversation today is one step towards for me to identify some of them problems there. But the other step too, with very, very important. And it's really funny. I was talking to an African, because like I said, Mina University professor too. I teach California State University, East Bay. So I was talking to an African American great scholar, brilliant man. And just about this problem I get from Dalinda, I would talk to him with that. I said, and he can travel to Africa, but one day go Salon, one day go Liberia. But you don't go out, they could go Nigeria, I can go Ghana, I can go South Africa, and then place then they. So I said, this problem here, so I said, this why that serious problem will get so. And how you can help me, so I can help me people them go out of this business for help yourself climb out of this year. So. And you know what he tell me? It says simple. It say all throughout me travel in America, in our don't get organizations. It say, look, in America, the reason where civil rights come into play, now because of the churches. And I don't get the churches. The churches are already organized. And I don't get the mosque. The mosque already organized. And I already get KDU. KDU already organized. And I don't get all this organization that we don't do at the place. What in I get for do? In a back again to it, yes. In a collaborate. In a come together. In a begin talk this talk here for see how we can able to uplift ourselves out of this problem here. Give me the example of the civil right. Again, we got to pay attention to this. But this is a very important question. If I may, Monica, please answer this. Martin Luther King, the leader of the civil rights movement. Malcolm X, the leader of the civil rights movement. All the leaders of the civil rights movement. Then get dissident groups. Then get people that way me go against them. Then get people that way not like them. But you know what? They love black people and then see the suffering of black people. Marcus Garvey, he loved black people. He see the suffering of black people, even up till the way where they kill them. And all them Kwame Nkrumah, all them people that way they don't kill. They're still strong and believe say them go do them part for uplift black people. One person cannot do it. But if we organize, and in not organize, and they go now them churches them, the mosque them, if the beautiful people them. But therefore be able for, especially the spiritual leaders them, I can talk to them, I can encourage them. Yes. And again, maybe not even go into politics, but get your congregation, improve the congregation, not take money from them all the time. If you take money from them, use some of this money for make them better themselves.
Oh my gosh.
For make them better themselves. Yeah.
I hear you.
No, the scholar friend I tell me this.
Now that's immediately okay.
Tell me. You say now the only way that they will uplift yourself is that organize. The organizations is already.
It makes sense.
Organizations already there. And I get them. Now for utilize them, we get them, but they're dormant. Make them active. Utilize them. We can able to solve.
It makes sense.
And again, the other thing why they see, I can see this all the time. We get for stop for depend on white man. White man not they can solve a problem. Now we as black man, because we as black man, I speak general now, not to talk about Salon. We as black man, now we they solve a problem. We were the America, we know this year so. Which man, with man business, I know not to say me I no prejudice, I no prejudice, I know there's nothing against with man business. But if you're lucky, for me, get job like where Monica get where you're an administrator, 1 or 2 wait man must like you. But if Monica tell you what you go through, for me, reach side so today. And I don't go believe that. And only I don't say, Monica now an administrator, big time. If they do, and they talk to them salon people, then they get money, may send with money. And they tell them why go salon. I say, me not slave in America. Me not, I still not slave in America. So no come to me, I give you money for free. You just sit down, they do nothing. You don't know more because I come to America for give money for free. Me not slave. We got to give them that message there because the struggles, the prejudices, the discrimination, the problem where they encounter in the West, now the diaspora, it's not small. And we got to continue that. And I say that to encourage people in our salon, say, but quickly, I finish this, and then I will go to other question. We will, especially people that we don't reach retirement age right now. Some of them, they go back home, no matter what, then they go back home. You know what you do? Because of the cold. Look, the winter road just getting at the East Coast this year. Hey, snow they reach 8 inches, 12 inches of snow. You they 65 years old, they can't shovel snow before you go walk. Yeah. They can't shovel snow before you go walk.
Yeah.
You go rather go salon. I mean, when they deal with 6 80, maybe they salon, the 80 degrees, breeze the blow, so the place so nice. Salon a beautiful place, man. Let's stop this nonsense for the criticize salon all the time. The temperature, the palm tree, and they look at the palm tree. If you see where the breeze, they blow the palm tree back and forth, and they look at the beach, the water looks so beautiful. I say, now my country this that they can't slave. I know some people will disagree with me because some people they don't like to talk nothing good but salon. But
I'm glad you say that because this next comment, Annie Copeland he say welcome doctor. He say some of the people in a man and they're not helpful. He say thank you to Wina Yard Road for where we bring you come at the show. Much love.
But must speak to that. Must speak to that. That's a great comment. You know it make our people an active man because they're victims of trauma.
Come back to the same thing. So in a full circle.
Thieving is not a natural human behavior. Thieving is result to deprivation. Thieving is result to deprivation because they don't get. Now make them the thief. Believe you me, most of these Western countries, the psychology, they can do a psychology research to find the most happiest place to live in the world, the most happiest place to live. And one of the questions to determine the most happiest place to live is how safe are you from thieves? And what they do is they do the research by someone will drop their wallet. They will drop the wallet with money there. And some places now this world, that wallet you go, she don't take the person come back and find the wallet. Nobody know the touch her. But salon, you drop that wallet, the money there, not even 2 seconds, that money they don't go. Now because of deprivation. That country where that wallet nobody
then they're not so thieving or then they're not lost and found. thieving that way you then you possession somebody can take and the way you don't know. And they don't ask you permission.
Well, yes, I agree with that definition there, but it's not because of deprivation.
Yeah.
If we're able to produce back again to hope, people are doing something for themselves, the thievings will reduce. Well, that's my theory. That needs to be researched.
Okay. This is not Waltina and brother. Your other cousin.
The other cousin, yes. me and he hang out quite a bit. Yes. Me and he travel all over the world. We can connect, we can hang out, yes.
And they tell you thank you. So Oluna, your other name. Okay.
Yes.
All right. It tell you thank you for your professional insight in some of the problems them in our country. They say after the war, a lot of people them were affected mentally. A lot of people them be affected mentally. It say and it affect the current generation. That is so true. And
Well,
that's what we need to talk about
that they called generational trauma.
trauma. Yeah.
Yeah, and we see today, where Victor just crystallized with the point where they want bring come home from this discussion today. Most of the problem we see today, not to see a problem that today, most of them start from the war. Since the war, the country, like for example, Victor and sister Waltina, we left Salon in the 70s because again, this now again, I apologize to them. I don't want to be disrespectful. The students think say I can apologize too much, but again, in Buddhist theory, a good level apologize because some people think. But in the olden days, when we grow up with Waltina them world. As soon as we turn 18, we parents them either go England, go America, send we overseas. But when we go overseas, we're not a day long. As soon as we train, we come back home. Because home means sweet. But ever since the war happened, the country changed. And we just they see the problem, we see the problem, we see the problem. Now, believe you me, the go back to I really go back. I forget the clinical etiology that the word I look for. The etiology of the problems that we're dealing with today is a result of that civil war. That's alone. Victor is absolutely correct.
How we can solve that?
Well, now we don't depend so. We begin to stock here. So again, it go back to what I can encourage enough for do. Broaden the scope. Let do more na salon. Let do this talk. You see, salon people them again. Even where I can speak to in so if you I'm surprised with the number of people that way they call me, say, be careful what you they say, oh, be careful what you they say, what you they say, oh. And I say, okay, I will just talk about mental health.
Oh,
But
wow.
continue for be careful what you they say. But again, talking, like we say in America, talk is cheap. Not just talk no more. Let we do something. And we'll say, let's do something. Not that they give money no more. Not they give no more. Let's do something. We get, like I say, we don't organize. We get the organization. How we go able to bring ourselves up? I don't know. We will start from the, we will take all of ourselves for more to bring that discussion there for more do. But
Yad Road and KDU, we dey do what we can. We dey try. If we can get more help from other people, them, other organizations, them, churches, them, most of them, just like how you say, I sure say we can make an impact.
But again, Monica, let me come back to you. Myself now, not until I listened to that forum when I get last week or 2 weeks ago, me no know see Yard Road exist. And why don't listen to, I tell you that, me know. Why don't listen to, I just use myself as a sample, say maybe Boku people they don't know. And what a great, looking at technology, look at the advancement of your technology. This now serious business in that they get going on right now. Use this to expand. Yeah, to expand, then I reach other people them, and I go to the churches, and I tell people them where you road, and say when they meet every week go in a camp, we will make me and myself camp, low talk, but no more low not stop by talking. And again, the reason why I say we'll not stop by talking, back again to mental health. Me on talk why I don't bring canto in us. So one of the my own contribution, because I call myself a behaviorist. I believe in behavioral change. My own contribution, now for me, we begin recognizing we as a generation in Salon and also the diaspora, we they deal with some mental health issues. You know what I mean? Say because you go work every day, you do this, you do that, you get money, they send back home, you okay. No. We they deal with some mental health issues.
Yeah.
So my job for me will recognize that, and then next step, what I can do for help, because I believe for do my own part for help. Yeah.
Waltina say, is it why we have Ramadan and Lent together? You know, as a people, we love to pray. God help us.
Well, prayers, there's nothing better than prayers. Number one, nothing better than prayers. Where I can work, like Richie, I say, I don't left for work with kids, but where I can work with kids, them, I can tell the parents them, I say, no, look up to me, oh, I can give you all the theoretical knowledge for make you help raise your picking. But the number one thing where they make a difference by picking, now for pray every day for your picking. Because you never know how your picking will turn out. So without prayers, no, prayers is number one. Again, I'll go back to spirituality and the research. I just read the research for Margo teach me school them. The research shows that we, again, this is in America now, we as therapists, psychotherapists in America, we're afraid for talk about spirituality, but we patient they want to make more talk about that. And we're not to say we they embrace any one type religion or any one type denomination, but just speak about spirituality in general. And whatever way that person they see in spirituality, be it organized or be it individual, encourage them, make them focus on that because it help them with the mental wellness.
Of course. Waltina say waiting me they try for say earlier now that the problem them the multiple and it seems as if we know they make a dent in the problems. And that's true because we really they try. People and organization and they really try. I know for sure say KDU they try, but it really look like say they make a dent.
Because you're trying silos. You're trying silos. For example, I'll give you an example. I was invited. Hey, Mema Tokyo, they invite me for make be part of the forum for address the Kush problem. The American ambassador was there. The Sierra Leone ambassador to America was there. Really wonderful people. Then we can make a difference in the problem with Kushna Saloon. But one of the things where I identify is that whatever help then they do, everybody just they do their own little part, their own little part, their own little part. And if you do your little part in silos, you're not going to make a dent. The problem is too big. You get for come together for be strong and mighty to identify the problem. But if you just do your own little part, you did by yourself, you're not going to make a difference.
Make much, okay.
But one more example, a big. One minute salon. This go back to Waltina. 1 minute salon. I mean, go Maroon Church.
My favorite church.
Yeah, KDU get one special service in Maroon Church. So I go Maroon Church. And the preacher will preach. Solid preaching. Solid preaching. But some people they go oppose the preacher and say, this preacher they talk about politics, this, that, my church, then kind of things, then they. But what's in the preacher they do now for insight, because the problem is we all suffer from trauma. We also fall. One of the symptoms of trauma is that we are asleep. All of us are asleep. And if you want to wake up, the minute you want to wake up, somebody will tell you, no, wake up, oh. If you want to wake up, they got trouble, you they look for yourself, so, or you they look for trouble for the family. So no wake up, oh, go back, may go sleep. Which make me wake up. And then
why in America, then they stay woke.
Yes. Then, but people will call me, be careful what you they say, oh, no, make sure say, upset people, but look what the trouble we'll get. And no more would they always be careful. I will go be careful, Tete. Martin Luther King was not be careful. Malcolm X was not be careful. Marcus Garvey was not be careful. Come on now, folks. We need to wake up. We're afraid people then too much. Again, me not they incite people that made them do riot too. But again, I go back to these reasoning skills where God give us. And must say this much too. Salon people are not to dumb people them. Again, this let me bias, but we and Nigerians now, the few black people that we God give with so much intelligence, we not even know. We know that whether America, we know that. We don't see. Look at me. When me in the salon, me no me they get A. When me in the salon where I'm the good school, I will be very honest with you. So tell class of 35, maybe I would be number 10, number 11, number 15. But look at me now, doctor today.
Yeah.
You see what you had to say? So,
Yeah.
so God give we salon people them, God give we intelligence, we not brilliant people them. So now we use that reasoning skills, more better we said, instead of being afraid all the time.
I
But
agree with you.
I really apologize for saying that because
Oh,
some
no,
people
that's
now,
fine.
some people are now then will say they try for inside problem. I know why inside problem. Just one praise we say we not a dumb people. We not Salionian, we're not dumb. Look the history of England. Look who the contribution with Salon do. Do you look at the contribution with Salon they do today? We're not Salon people, then we're not now we know now with the education, the phone full, small. But the education will get home in the salon. But teachers invested in women because they know say we're not very brilliant people. And we get to continue this brilliancy.
We have to.
Some people are not died and they die so. Now the brilliancy they go so. So if we not mentor with young people, then now trouble don't cancel.
That's true. Annie Copeland, na Ronnie we been there on earlier na sister this. So Annie Copeland say in brother in radio station, then get another brother, we get radio station, when him Tempo radio station. He say that station they talk every week about mental health. Okay, now he said them been they talk. So I don't know if they know they talk about time again or I don't know. Annie Copeland, I don't know the station still there. And if they know they talk about mental health again, let me know why, yeah. Put on the comments if you can. Then Waltina he say inform me freeze. He say the problems are multiple here. Oh, now that's him they try for say here. Okay. He say more when he came. Okay, inform me freeze. Miss have your internet the freeze now, yeah, so I understand. Ronald Georgestone say he say stealing na the new norm na salon for a long time. He say even the one them will get authority, then live by that. He say yet then think say it's okay. When they're not.
But you know, it's the culture. It's the culture. I absolutely agree with that statement because we reach a point now in our society where stealing is a norm. It's a culture, and that needs to change. And that how does that change? You know, that statement is a very troubling statement. The reason why we're to make that troubling statement is because definitely the statement is correct. And then the change, definitely we need a change. And stealing, again, it goes back, I'd bring them back to mental health. It's because of deprivation, this trauma deprivation that leads to it. But stealing go across all levels, na salon. All levels. Just the regular salon. Sometimes it can make me wonder where to make Salomon believe say other Salomon so fool that you believe say you can steal from this person and then come back to this person, make this person do you good help you again. No. It cuts across all. It's a cultural norm in Salon right now. And that takes, if it's a cultural norm, it takes an effort, a cultural effort to change it. Excuse me. It takes a cultural effort to change it. So it's the problem is big. Stealing, the problem of stealing is big in Sierra Leone, but that doesn't mean it cannot be resolved.
Yeah.
Yes.
This na your other cousin, Mrs. Knight. He say, hello, doctor. He say, they're expecting the difference between madness and depression. Reverend Eugene and Melfina, right?
Yes. Yes, now my other. You see, I get Boku cousin them. You
I
see, I do
know.
well. I bring me cousin them on board. Yes,
That's what I see.
yes. Now, and again, I can tell me cousin Malvin. I say, hey, no give up on me, oh, because he call me. I know the answer. But again, like he always big. I say, no give up on me, and you never give up on me. So I appreciate that. I will put on at the forum. Say, I thank you for you not give up on me. The difference now, good question, Andy, and thank you for bringing me back to mental health. The difference between madness and depression. Madness, the way I can answer this, madness now in we call and say you get psychotic. You're psychotic, not psychotic disorder. The madness is now what you will know back home will say somebody crazy. Meaning something happened to your brain not to function anymore, like what is supposed for the way we're supposed to function. When we then we can recognize that back home when we say that person they crazy. Now we call madness. But depression is different. Now good question you ask me. So depression different. Depression, now what you call neurosis. Depression, depression, the main reason for causing depression, now your environment, then they cause depression. Remember now, madness, now your brain, something happened to your brain. But depression, now your environment, now they cause depression. And in depression, now something, for example, I will go back to trauma for answer this. Trauma can cause madness, trauma can cause depression. The way with trauma that cause depression is when someone is traumatized, then the symptoms of depression is the person not able to eat, the person not able to sleep, the person not able to go walk, the person not able to socialize with person, the person easily they get upset, they get angry. Now depression and the madness where somebody crazy, meaning the person they talk to themselves, the person they hear voices, say Jesus they talk to them, the person they walk on the street they talk to them. Now the difference down there between madness and depression. Hopefully I answered that question. Monica, what you think? You think she answered that question?
No, yeah, you did. Yeah. Not a doctor, Annie Copeland say, okay, now want me to ask him about the radio station. He say in border in radio station be very popular. He say everyone been they listen to the station. He say, but waiting then do, then shut them down. Other than the them I don't know if my border then shut them down but I don't think so. But anyway, in other words, the radio station no they operate anymore. Now the comments then that so far.
Well, the only thing I can encourage people to do again, because I can see this on social media. One of the things, two things. One, we're very fragmented, meaning that we do things in silos, and we need for come to collaborate. For you to treat trauma, you need collaboration. And right now, the country is traumatized. Based on your comment, not to me they say that to me just to come up with the diagnosis. The diagnosis based on your comment, the country is suffering from acute trauma right now. And one of the treatment for treat trauma is collaboration. That's one. And secondly, Solomon, we let book business. But now one thing that the English people then give me one or leg, give we one or leg. Then give it too much book business too much. We let book business too much. Everybody want read, one be knowledgeable, one know this, one know that, know all the country in the world. Who care if you know all the country? American people, they're not busy about that. They're busy about the work where they do. Busy say the work where they do, and they do the best work for me contribute for the development of the nation. But all we want to do now for read book no more, no say we all get education. We get for stop that nonsense the way the English people and bring country. And we get for change. Meaning that we get for work. America, the one thing one learn America past anything, two things. Actually, because back home, me not to mean chief man, so I don't mean no about chief business. But two things one learn America is the value of work. We have to work. For your country to be, go see don't know why they go on social media. I see people them, some of them people there, all them they do no more now for scroll through TikTok all day. What you now go do for you? Impress me, say, you know, social media. I'm not busy now. Chinese
Oh
man,
my gosh.
Chinese man want addict you into poverty. Chinese, I put this message right now. Chinese man want addict you into poverty. They scroll social media all day. And then they work for better than country. And then they give you TikTok and all you they do that for scroll social media. And I left them nonsense then they man. And I left them nonsense. We got to pay attention. I don't travel to Thailand. I don't travel to all these Asian countries then they. For palm tree where they now, wherever country. Now we didn't give them palm tree, but now they're the number one exporter of palm kernel. Which kind of nonsense? Because we did scroll social media.
Order that.
Yeah, Singapore, Malaysia.
Oh, okay.
My guy, now give Malaysia palm tree.
Wow.
Now
I never know
Malaysia are the number one exporter of palm kernel. And again, now I can encourage you now all where they listen to me. Begin read all the things the way they eat and drink and the soap the way they use. All of them get palm kernel.
Yeah. And come back to what you mean. They talk about a man cow, woman cow.
Yes, same thing.
Yeah.
But you go back home now, the last time I go back home, I speak from concrete example. The last time I go back home, I know we said the hotel where they, but I mean they were in a hotel with one guy from Kenya and the other one, I think one of the countries in South Africa. They can't salon for can help build the hospital now Kono through Allied Health. Both of them were engineers. And they were so disappointed. This is now your African brothers. They were so disappointed with Salonian. One of them tell me, he said, if I did salon, I get power in a salon. The first thing I would do, that for broke all the veranda the way they salon. I said, what you mean? How somebody go wake up at 8 o'clock in the morning, all the sleep for do that for what you don't have veranda. You don't sleep all night. You wake up, and the only better thing for you for do that for what you don't have veranda. He said, I go broke up all the veranda with this salon. We get for learn this work ethics, we get for embrace them. And once they embrace them, not say it, but now left this book nonsense. I know I'm an educated person, but no, truly, work ethics, we get for be able for be strong because we got intelligence. Let's put it into practice. I'm a behaviorist, we get for work. And this thieving, this lying business, Lord, stop. American people, you know, we were the America, we know America. We were the America, we know America. I don't know other country, but two things where American people don't like. The two things where American people don't like. People where they lie, people where they thief. If you come America, you know landing things, then they fail in America. Yeah. Because my boss can tell me, just tell me the truth and I can help you go through whatever problem. But if you lie to me, I'm not going to know how to help you. Yeah, go ahead with the question. Mm-hmm.
When you be young Bobo, you know say salon, Creole people them back then, Saturday night and they cook them fried soup. When that fried soup can cook Saturday, you know can go thief beef inside the pot.
No. Because, well, you know, that's a simple answer. A simple answer. Because no reason for make her do that. Because the soup when they cook for Saturday is just as good as the soup Sunday. So no reason. My friends, they want me to.
You're not the only Creole Bobo at the time when me know now we not ever thief beef in a pot.
No, I don't go say that. I don't go say Boku Creole. Me party them, they know me they do that. Me party them, we know me they do that. Because we won't come out school. And ask me about my school. We won't come out school. Me and me party them. We can go down me party the house, then get bread, then get soup. Man, we mean they with the condition what they now, it not relate to what you in the past we mean they in abundance, man. We mean there are things then.
When we begin think of the past and then the depression they begin setting.
Well, no, stop that because I don't want to provide treatment. Or I don't provide enough treatment. But we got to go back into that privilege of because you know me always there like this. So even this American dollar, Salom do money me strong past this American dollar. When me come, the time when me come America and Victoria and me cousin them, Waltina than where them go England. The money women get, it is strong past the money where in the America. So this problem will get so today. Something little to this problem, and we got for work for me bring we back. Maybe we not go back because me not one of them people the way I never provide intervention or treatment saying let's go back, but let's lead we to something better.
You think say we go live for see the changes, or now we begin and go see the changes?
Yes. Absolutely. Absolutely. I believe that. My brother can always tell me, say, my big brother and an engineer, he can always say Salone a small country. For change Salone, you know, will take much. And I believe that. But no more, we get for responsible for our own change. But the minute we let Whitman and Cam can tell we have to bring with change, we not go change. Because Whitman them again, oh my goodness, hopefully this is not the politics. But then they come with their own.
If you doubt in a politics, then skip them.
Skip up. But then we therefore we're responsible for our own change. All the change that we don't see, because we'll get for land. This is not the politics, but we'll get for land to see how Americans, African Americans, brought about, because this benefits what they enjoy in America today. Now, under the auspices of Marcus Garvey, Marcus Garvey was a Jamaican. He was not an African American. He was a Jamaican. Marcus Garvey, Martin Luther King, Malcolm X. Those are the benefits that we benefit. But they brought about change. And look at the problems that they. I'm not saying America is perfect, because people can always remind me about the problem with America. Yeah, we got problems, but you know, things are better. Things are better. Yes, things are better. Dr. Blyden, I also wanted to bring Dr. Blyden, because Dr. Blyden is a Salone man, a Salone Liberia man, but he also contribute to the progress of Black people in the world. I want to throw that in there, and I want to throw that in there too. Yeah.
Okay. We don't go over with time.
Oh my goodness, yes.
I know. I been tell you, I said the time go, you not go realize it, time don't go. But at this point, what thing you want for left with today? What you want for left viewers with today?
Well, two things will come out of this for me in this conversation is low recognizing we are in a very traumatized position. Not only the people that were in Salone, but we were there America too. We were there overseas too. It's just the level, the type of trauma is different. It's different. What would the trauma where they suffer now, a different past the trauma that were in Salone. So it brings me back to the point that we were there now, if we able to bring ourselves together. We have to collaborate as one nation, one people, and broaden the effort for make the country better. I think so we'll go before.
Okay. Thank you very much. Dr. Potter, I appreciate you. If you don't mind, later on this year, around the September, October term, I want to bring you come back on a yard road, because when you say the holiday go they come, Christmas, this, that, and all holiday they come. I go on for let you prepare we mentally for the holiday madness day. For we Naya and for them in a Salone. So if you don't mind, later on this year, I will bring you back na yard road, yeah.
Yes, and again, go back to Malvina, my cousin in question. In America, we get what you call seasonal depression. Seasonal depression. Because sometimes we can get some of them festivals, they are like Christmas, Boxing Day, Christmas Day, Easter, and so some people like in depress, so not to everybody they enjoy. So I think it's an appropriate time now. Whenever you need whatever contribution I can make, please, you can count. My schedule, like my other cousin tell you, for me, reach me not easy. But like my other family will tell you, because they do presentation I did at Detroit. They do because I can do a lot of presentation. But for me, reach me not easy. But me family them, me people them, me salon people them, me country. I like the country beautiful, man. I take picture of some pictures them of salon people them. I show them picking them. They not believe what in they see. They not believe saying as the Africa and that beautiful country. No left that country there, so we can't sit on here with the slave. We can't dine. Now the trouble and look what all they dine at this country now. But anyway, now then a different topic for different time.
So we get for stay woke, bottom line.
That's it.
Stay woke.
Activate ourselves. Yes.
All right.
Yes.
Well, thank you very much for your time. I appreciate you, Doctor. Famble them on our way they watch. I know say we don't go over. I tell on a thank you for on a term. I tell on a thank you. Do ya on a continue for watch your road. On a continue for support we. On a subscribe. On a share. On a follow we on Facebook as well as YouTube. On a share this program to anybody who wanna think to take him benefit from yeah. And mental health, not to pass, doctor diagnose you, say you get mental health, at that 10 day you get some kind of mental health, so you can get some, know. Like our doctor don't say, when I go back and watch the show from the beginning, till they wanna miss, when I go able to pick them up there. Until we see back next week, Mina Morenike, I say thank you very much to all, and I say tata.
Ya run na the base, yeah. 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 For push Creole don't go before. We go make Creole culture shine. We go make am glow. Ya run na the base, yeah. Don't go before. We go make Creole culture shine. We go make am glow. Ya run na the base. We dey represent. Creole don't go right. Ya run dey make am best. Ya run na the base. We dey represent. Creole don't go right. Ya run dey make am best. We got the viewers, fans, them love the show. Sponsors they support. We go make them know. Say ya run na the brand. We dey promote Creole pride. We go keep the culture alive. We go keep am inside. From the music to the dance, from the food to the art. Ya run go keep the Creole spirit straight to the heart. Ya run na the bases.
Welcome here at Sharp Primary Care. We are located here at Columbus, Ohio. That is 4889 Sinclair Road, Suite 103. We are located right in between 161 and Morse Road. We are here to serve our community in different capacities. We're here to take care of all your primary care needs, whatever you need, and also as you come here, if you need to be outsourced to different